The body is a very complex matrix of systems which work individually and collectively. When you get sick and experience some symptoms, how does your doctor tell what is wrong, considering that the body is fully covered with the skin? By looking at the symptoms. The same symptom in one person can mean a different illness in another person. This is the dilemma that is facing health practitioners every day. The headache of diagnosis. In this show, we present you with a medical intuitive who transcends the barriers of diagnosis and treatment and make this look so easy. Watch the show and be amazed.
I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses.
According to into yabo research yabo ayikho treatment for lung disease.
This is a God-given gift which is coupled with my training and acumen for physiology and anatomy. Over the years, I've successfully diagnosed and treated illnesses that have defied even the best of some of the medical practices. We all have our life purpose, and this one is mine. Every pregnant woman expects to give birth to a beautiful, healthy, and bouncing baby. Not a single parent expects something to go wrong with their babies. And when it does go wrong, they count on their doctors to fix the problem. What happens when you give birth to a baby who has got such serious breathing problems that he cannot breathe without the assistance of a portable oxygen? The doctors tell you they cannot help him, and within months, he dies. You try again. Baby number 2, the same fate occurs. The doctors cannot help, and also within months, the baby dies again. And you try again. Baby number 3, and you've got, while you're still carrying this baby, your nerves are finished, because your fear is, what if the same thing happens? And your fears are in fact confirmed. Baby number 3 has got the same condition, and the fate is inevitable. What do you do? So in our show today, we're bringing you a young woman who went through this experience that I'm talking about. Please stay tuned as we listen to her story and hear what happens to baby number 3.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel. There's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.
We have here our special guest who is here to share a story of a child's illness and the painful journey she went through and how alternative medicine made a breakthrough for her. Welcome to our show. How are you?
Ngiyazibusela emakhaya igama lami uNtombazandile Mangazana.
Is umntana wakho, what happened to umntana wakho?
Okay, umntana wami nguBlessing Mangazana. ndambeleka cesarean section bengumntana normal that bengumntana right kwakonto ngoku ndandimbeleka. And then after 3 weeks waqala wakhofa wakhohlela, and then ndamsa kagqirha, and then wathi ugqirha pneumonia. Ndabe ndinabo abanye abantwana ababeyi-2 abaswelekayo, and nandisendiyazi nee-symptoms zesi sigulo uba anazo. And then after kagqirha then nda-explaina i-history yam yabantwana bam previous, and then kwabe sekuqaliswa ke ngoku kuthathwa amagazi kwenziwa yonke loo nto leyo. Wabe umntana seyathunyelwa e-Red Cross Hospital, apho bathi find out uba uBlessing una-same disease as abanye abantwana before.
Okay, babeyibiza ntoni disease?
Babesithi it's a very rare disease, i-alveolar proteinosis, if ndispela like proteinosis.
Wayengaphi xa?
Yeah, you say weighs, I think wayene 2 months.
Wayene 2 months. So umsa kwakhe Red Cross wayese serious.
Wayese-serious.
Symptoms ubukela xesha.
Wayese-breatha nge-oxygen, babekwi-nasal probes, and then efida nge-tube. Wayenombhobho wayefida ngayo because wayengakwazi uzincancela like ukutya.
Wawekhona amayeza wayewasela ngelaa xesha okanye
wayene-antibiotics, and then up until bam-admit ke wayese-Red Cross, so bekwi-medication. And then bekubakho like oogqirha masibaya babayi-team, and then kudiscusswa ngekhisi yakhe as babenditshilo before uba abanye abantwana previous babenale same disease. So kwakune-team overseas but ndandiskypa nayo, babefuna uyazi into nobangela wesi sigulo, but babengayazi. I think babegesa kuthiwa inoba yile noba yile, zange bade bayichane kakuhle. And according to into yabo, i-research yabo, ayikho i-treatment for le disease. So kwakutrya i-treatment for uba lo mntana abe right. So bambiza as i-chronic, wayene-treatment ayinikwayo is-Zectromax nezinye izinto for uba like akwazi like usurvive kancinci. Qala bebesithi abanye mandiyohlala bamdischarge, mandiyohlala naye endlini bazophinda aphile, but because of imithandazo ndanethemba uba uThixo uzoliveza icebo. Up until kwabakho le treatment yabo, but nayo yayingamncedi, but ndandiyisebenzisa ke nje kuba ndifuna umntana amaphile, but ingalahlanga ithemba kuNkulunkulu uba uzoliveza elinye icebo.
Okay, Zandi, masike sijonge ii-symptoms. Ii-symptoms bezithini?
Ii-symptoms zakhe ebengakwazi ukutya, but xa ezama like because wayengumncinci ngubaba, so xa umnika i-milk like bottle uzokhohlela. Uyambona uyafuna ukutya but kukho le nto imenza uba angakwazi uncanca, and then uzovomitha, and ebusuku ebengakwazi ulala like ubusuku bonke, uzokhohlela, and then aswethe noswetha, and ebengageyini ne-weight.
Wawukhona umahluko awenzayo amayeza ngelaa xesha?
No, ubungekho umahluko because zathini ububa khona for ixesha elincinci, and then mandithi bingapheli iveki enga-athekwanga i-infection entsha, and then bengayazi uba yenziwa yintoni, bingapheli iveki.
Okay, even though ebesela amayeza?
Even though esela amayeza.
And wayenangaphi ngelo xesha?
Wayeseno 6 months ngoku sibuya from Cape Town, sithunyelwa apha e-PE.
E-PE.
Yes.
And ke Cape Town wamsa esenezo symptoms, wabuya esenezo symptoms?
Yes.
Kungekho mahluko at all?
Yes.
Now, as umama who's had i-experience yabantwana bakho ababini before Blessing, I'm sure ixhala. I just want us to share with us what was going on through your mind, the emotions you were going through. What was your experience to all of this?
Kwakunzima kakhulu because ndandiyazi uba ii-chances zoba makaphile zazislim kakhulu, because ndiyayazi uba bazamtrita and then ba-endaphe bathi kanye bayagive up okanye mandohlala naye ekhaya agoduzwe. So kwakuba nzima kakhulu because kwako easy up until I met Pastor Paul. McIntyre Hospital because ngokesela PPE ebengu-in and out esibhekele, and loo nto yayisendina, and ndandincediswa yifemeli yam, nabo ndandibacingela. Ndingakwazi ulala esibhekele, wayekwazi ulala for a week esibhekele 7 days, up until I met usistem. Waya wayomjonga umntana wabuza uba yintoni, bathini oogqirha, nenda-explaina bathi yintoni. About 2 days after ndimethile usistembi wadischarjwa, then waqasa itreatment ngasistembi. About 3 days isandosebenzisa kwakune-improvements, uba wayeselala, yes, esizibonayo, elala long hours, and nalaa nto xa esitya simfida, because wayengumntana xa wayenepeg sasimfida ngayo, wangakwazi uzincancela nangoku sekhululiwe. Kwakunepeg wayefakwe yona plus ne-oxygen, so sasimfida through pipe, and then we explain yonke le nto leyo kusistembi. Engatyiwe, engazityi solids ngomlomo, not at all, wayesifida ngepeg, uzawukhokhela avomithe. Xa eqalela, after eqalela treatment ngasistembi, zaye zisihla kakuhle, wabe kanti uyancedakala ke ngoku. But nangoko usistembi bengaphelanga itreatment yakhe, because ndandinotice uba ndandisendimazi ngoku umntana unjani, uba siqala ndandipenika kakhulu. Usistembi lo mntana akatyi, akazityi solids, and yayiwari yam uzokhula njani ngeformula yodwa. After nje bandiqhubekeka netreatment, usistembi wandenzela ukutya kwakhe, uba mandimtyise into ethile. But xa ke bandifumanisa usistembi uba lo mntana utye ipotato, ikhofi iyabuya back. So wayengumntu endicebisayo, sumtyisa into ethile, try umtyisa into ethile. So engaphelelanga itreatment yodwa, wayengenelela nasekutyeni kwakhe, nyani sabona umehluko. So ndandisendiyazi uba botye iyogathi izawutriggerisha ikhofi yakhe, bawutye peanut butter izawuvuselela ukhohlokhohlo lwakhe, up until ke ube uyaphila ngoku. After eqale itreatment yalapha kaThembi, zange aphinda sibone isibhekele, and ndangayekanga ke nothandaza, but afumanisa uba iyamnceda kakhulu.
Before udibana nosistembi, what was your view on alternative health?
Yho, ndingaziniksi ngento i-treatment yaka-natural, up until ndava ngoPastor Paul ba-introduce wathi kunelady elise-P14 elinguThembi elisebenzisa into zaka-natural. Mna ndandicinga into zamagqirha, ndathi hayi Pastor Paul. Wathi hayi, zinto acinga uba ziyanceda, uyacela ucela undidibanisa naye. And then ndavuma ke, wabe sefika usistembi kum, ndam-explainela uba kwenzeka ntoni. uBlessing waye-admithwe eMcIntyre Hospital, waya uyombona. And kwafikelela ixesha nyhani ngoku bafuneke emane esiya for i-check-up kwagqirha. So ndaya kwi-check-up, ndamxelela usistembi andizokwazi ubafika lo gqirha, fanele ndibaxelele ngale nto ngoba ndiyawubona umehluko. Ndabe sendibonisa kuDr Belcher itreatment endiyinikwayo, zange abe na-problem up until eyenza i-check-up eCape Town, ngoba befuneka aphinde abuyele aye eCape Town koogqirha abakhulu. Waye eCape Town, ndababona ooprof zaa. Into eyandisapurayizayo, andithi wayefuneka ahambe angene kumatshini omkhulu ezikenza phaa, bafumanisa umehluko kakhulu, iilanga zakhe ziyatshintsha, zitshintshile. And then baba ne-question yokuba kwenzeka ntoni, why uBlessing, bayayibona uba iya-improva kancinci kancinci le disease, kwenzeka ntoni. Ndandiphethe iplastic ke yabona, yes.
So
ndababonisa, bawafunda, bathi noba abafuna ukuthi ke ancedwe, ngathi noba yintoni but amncedile, bavele batsho noba yintoni encede uBlessing, bayamangazwa, like uyanceda, iyincedekile, yes.
Wow, Zandi, this is actually an amazing story. Okay, Zandi, unjani uBlessing ngoku?
uBlessing right kakhulu, uyakhula. Last year beqala ukuya e-creche, and then this year wenza pre-grade R. Young into right, akakho oxygen, akasatyi nge-cube, uyazityela.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel. there's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.
Welcome to Dr. Alternative Show. This is the first of its kind show that showcases the abilities of alternative medical practitioners. Some of you may be hearing for the first time about alternative medicine, and more so about medical intuition. The reason why we have this show is to provide a platform where we can educate the viewers about other health modalities that are available out there, and this will hopefully help you to have an informed decision and to even have better choices when you are faced with challenges of health. I am a medical intuitive, and I fall in the category of alternative medicine. I am the one who treated this little boy that we're talking about in this show today. Here with me, I am with Andiswa. Hi, Andiswa. Andiswa is going to be engaging me in the discussions, and we're going to be covering some of the questions that come from you and some of the questions that you may have about this condition. Enjoy the show.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel, there's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.
When I met this little boy, I had been approached by his mother to assist her. She was quite desperate because she had lost 2 of her babies under similar circumstances. She was panicking and she really was desperate. So I went to visit the boy at the hospital because he was still hospitalized at that time. And when I saw him, I felt sorry. My heart was really touched. He was on portable oxygen. He could not breathe on his own. His respiratory system was bad. He was on cortisone because remember, when you've got such a poor respiratory system, the exposure to inflammation is very, very high. And for the doctors to contain the exposure to inflammation, they had to give him high dosages of cortisone. Cortisone, we all know, has got serious side effects. But when you are faced with such exposure to inflammation, as it was the case with him, cortisone side effects are a lesser evil. Otherwise, he would have been overwhelmed by the inflammation if he had not been given that. So now the side effects of cortisone made him to have a moon face. As you can see, his face looks a little bit round, and his cheeks were actually drooping, as if they're falling. Those were the side effects of cortisone. His stomach was big because his liver was distended. He was looking very, very malnourished. Much tinier than his age actually was. And he was also on Prenan. Now, Prenan is the milk formula that is given to babies that are born prematurely, and at that level, still at birth. But in his case, he was a couple of months old, but he was still on Prenan because his digestive system was almost dysfunctional. So, which is why he was malnourished. So this is the little boy that I saw, and in a nutshell, that is what I saw when I walked into that hospital. But the comfort that I had was I could tell what was wrong just at a glance. I had worked with babies of similar conditions, even though they were affected differently from his, and I knew I could treat him. So that was a great comforting factor to me. So this is the picture of the little boy, and this is how he was when I met him at the hospital. As you can see, the picture is not very clear, but if we're going to zoom so that you can see that he's actually got some tubes that lead to the oxygen cylinder next to his little bed there. You look at the cheeks. You can see what I'm talking about. That the cheeks were like drooping because of the cortisone that he was given. If you look at his little arm that is held by Aunt there, you will see that there's a tube that's it's actually coming from the oxygen cylinder and is going right through to his aunt. I mean, to the hand which is held by the aunt, and to his nostrils there. On the stomach, you can see on the stomach that there's a little plaster that has got a little tube that's coming. That is the peg that was used to feed him. Let's go to a break, and we'll talk more about this when we come back. Now, he already had a diagnosis. Okay. Now, his diagnosis was that he had what is called alveolar proteinosis.
Alveolar proteinosis is a disorder which causes alveoli to be filled up with fluid. This fluid is loaded with proteins and fat. Alveoli are those sacs that you find in the lungs which control gaseous exchange, meaning the input of oxygen and the output of carbon dioxide. When you've got alveolar proteinosis, therefore, these alveoli will fill up and therefore hinder the gaseous exchange. This causes extensive damage to the lungs, which will eventually lead to death.
But in his case, every 6 months, the mother told me he was meant to go to Red Cross Hospital because they would try and vacuum out that mucus. That was the diagnosis that he had. But personally, I had a different diagnosis. The condition that he had, according to my diagnosis, is called congenital disorder of glycosylation.
Congenital disorder of glycosylation is a metabolic disorder which the baby is born with. It interferes with the chemical processing of proteins and lipids, which are of paramount importance in cell production. The inside of a cell is made out of proteins, and the outside is made out of fats. Now remember, the cells are like bricks that make up the body. Every part of the body is made up of cells. If the bricks, therefore, which in this case are cells, are not of good quality, the whole house, which is your body, will eventually collapse. This is why CDG may affect every organ. CDG has a few different types which may affect the brain, therefore causing cognitive disabilities. It may affect the muscles, and it may affect the digestive system.
Now, glycosylation is not only limited to babies. Okay, I just want to explain that a little bit. People that a glycosylation process is a chemical process that work with biological processes of protein and lipids or even glycogen processes. Okay, so it is a very important chemical process that is necessary for the development of organs. Okay, and that applies to everyone. It doesn't mean it's only limited to babies, that when we are older it doesn't. Okay, so we all need glycosylation for our organs or for our survival. But when you've got congenital, it means you've got a disorder. You are born with the disorder of glycosylation. So it's not something that you have acquired as you grow, but it's something that you're born with. Okay. I will explain more about it as we go along, but I just wanted to cover the area where it is an acquired disorder of glycosylation. For instance, people that have got diabetes, some of them end up having serious complications because of the disorder of glycosylation. Now, how does that happen? If I may just give as an illustration, if, for instance, you eat something that has got sugar, okay, or that gets converted to sugar. Maybe you're drinking tea, you eat bread, you drink tea, all that gets converted into sugar. Now, once you have converted that into sugar, the pancreas releases a hormone which is called insulin, which will carry that sugar to the destination. Okay, that is to your cells, to your tissues, because sugar gives us energy. Okay, so even for that brain to function, for that heart to pump, for that stomach to work, you need sugar to give the energy so that those organs can function. But now that sugar must go to where it should be. It should not be in the blood. But insulin, what it does is it carries it from the blood and transports it to the destination where it's needed. And so it will say, get in here so much and get there, get there, get there, get there. So once that is cleared, then the pancreas will slow down on pumping insulin because there's no more sugar that is sitting in the blood. Okay. So sugar is not meant to be in the blood. It's meant to be in the cells, in the tissues where it is needed. Okay. But now what happens when your tissues are not receiving it? Or what happens when pancreas is not giving you enough insulin? Let's go to a break and we'll talk more about this when we come back.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel. There's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.
Welcome back.
Tammy, before you proceed, you've mentioned quite a bit about diabetes. And before we get to the actual topic that we want to discuss, can I ask you to elaborate more on that, please?
Okay, you mean diabetes in relation to congenital disorder?
Yes.
Sorry, in relation to glycosylation disorder. Okay. There is a lot of people that are on diabetic medication, and you find that a person will say, I'm sticking to the diet, I'm sticking to my medication. I'm doing exactly as I am advised by my health practitioners. But I keep deteriorating. My health is deteriorating. Some people that get amputation, for instance, say, I don't know what else to do. I don't know how to stop my limbs from being amputated because I am sticking to the medication and I'm sticking to the diet as I've said. Some, I remember there are people that will even say, I follow all those routines. Like, for instance, they say you must keep your feet dry all the time. You mustn't walk barefoot. You mustn't make sure that nothing cuts your foot and all that. They say we like living in fear all the time because I'm watching that nothing happens to me. But still, I do develop gangrene. Okay. And I've ended up with amputation. So now, how does glycosylation? Because most of the people that end up with a problem like that are people who actually suffer from a disorder of glycosylation. When a person has taken something that has got sugar, that sugar is transported by insulin, which is released by pancreas. But the importance of that sugar to reach its destination is between enough insulin and reception from the cells or tissues where the sugar is supposed to be taken. So if you've got problems of not having enough insulin, you will sit with sugar. But also if you've got problems of cells that are not receiving, that are not open to, that are in the that are resistant to sugar, to insulin, you will still sit with sugar. So either way, you've got problems. So which is why you find we've got type 1 diabetes and we've got type 2 diabetes. Okay. Glycosylation disorder, what it does is, because you are not receiving, your cells are resisting to taking insulin, they block the way. And then when they block the way, because it's like a truck that's broken that is sitting on the way. So when the proteins come to carry out their task, there is this truck of sugar that is blocking the way. And so what it does, it creates, so then it sort of traps, that sugar traps that protein. So that protein cannot move to go and do its work wherever it's supposed to go. So and then you've got what we call the browning effect. If you've seen those cases, that is why you'll find that people, for instance, with gangrene, you'll find that it will turn brownish. Okay. You won't find that it actually looks like a normal skin. It turns dark, okay, or dark, because of the browning effect, which is the entrapment of protein by sugar. So that is the disorder of glycosylation in an acquired scenario rather than being born with it. Okay.
Okay, can I go back to the diagnosis of the little boy? In fact, when I just briefly take you back to the history, I find this amazing. What I find amazing is, here is this baby who suffers from what specialists have given up on. And 2 of his older siblings have died. And, being the third one is faced with exactly the same fate. Now, you are called a medical intuitive, and I'm sure that some of the viewers, it's the first time they hear, about someone of your calibre. So you can imagine now being a medical intuitive and you're coming with totally, alternative techniques and totally self-sufficient by the look of it. You are totally self-sufficient. Can you just explain to me, or actually explain to the viewers, when you walked into that hospital room, how did you make sense of all that was happening, and how did you manage to convince the family that you know what you're doing?
Firstly, as I have said, this show is meant to showcase the abilities. It's actually to do what you are touching on, okay? Because, like you say, it's like Are you crazy to think that you can? I mean, here is this boy. He's got not one specialist. He's got a team of specialists. And here I walk, and I'm not a medical doctor. And I say, hey guys, I know what's wrong, and I can fix it. I mean, it's crazy. It is crazy. So that is what I walk with in every corner, whether I go out or people come to me, but that is what I deal with. Okay, so initially they didn't believe me, but then remember, what was working in my favor is that she had been with these doctors with the first child, and they told her we cannot help. She had been with the same doctors with the second child, and she lost the baby. So now she was with the third, and already they were saying it looks like it's going to go the same direction. So she had no option. She had no alternative really, other than saying, okay, let me try this. Okay. So this is what was working in my favor. Okay. But it's not something that is easy when you are an alternative practitioner, because you have to work 10 times more than what is expected of the medical doctor to prove that you can do it. Okay, which is not easy. Sometimes people think you're just taking a chance, because even with me, I mean, I had a doctor who actually called me, wrote an email to me and said, I'm going to report you to the council because you are misleading the public. And he said, I have never come across an alternative practitioner who can work single-handedly without the assistance of a conventional doctor. So you claim to be able to do this. I'm actually going to report you to the council because you're misleading the public. So, which, I mean, he felt justified. He felt he was protecting the viewers or the public, not knowing that I was not taking a chance, because the fact that I come on national television and show, the reason why I'm bringing clients is because people must be able to say, not hear from me, but they must watch themselves that, oh, look how he was. Look how he is today, because viewers are going to see how he looks today, that he's still alive, he's a normal child, and this is the child that every a doctor, specialist had thrown a towel on and said, we can't do nothing. So that is what I was carrying, that my knowing, my ability, and my conviction that I'm going to do it. Because when I cannot do it, I say it. Let us go for a break. And after this, we are going to talk about how I treated this little boy.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel. There's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.
Welcome back. We are talking about a little boy who had a condition called congenital disorder of granular acylation, and we are now going to talk about how I treated him.
Yes, as we go into the treatment protocol, Timmy, my first question is, how long did you take to treat this little boy?
Well, I started working with him when he was about 6 months, I think. Okay. And I worked with him for a few months. I worked with him for a few months for him to have a turnaround. But for him to have a sign, it was a few days. Okay, as we even had the mother who was watching. It took a few days for them to start getting a little bit of relief, like he could sleep, He was not coughing anymore. He could sleep right through because he could just couldn't sleep. Okay, even the feeding, even the whatnot. Okay, so it was a very short space of time to turn him around and show that he's gonna pull through, that he's gonna make it. But now, how did I treat him? Okay, now firstly, like I've indicated, that his problem was this disorder of glycosylation. So we've got protocols that work on correcting the glycosylation. Now, those protocols are providing something that's more like a step, because the glycosylation process has got a number of steps that must each do their 10, and once they've finished, then it moves on to the next one, and then moves on to the next one. So when you've got a disorder of glycosylation, it means certain steps are actually defective. So then it will hit that part, and then you find you're never progressing. So, which is the same as the truck, where I say that you might send a truck and it gets hit, and then you bring another one. Until you remove that truck, you're always going to have a problem of a blockage on the road. So we therefore have got protocols that work on providing a step or fictitious step that assists the progression of the chemical process to okay. So that's the first thing that I did with him, and that's the first start. That was the beginning of everything. So once we corrected the glycosylation process, then I worked on that liver. Okay, because remember the liver. Why the liver? The liver is the organ that makes those proteins. For instance, we get a protein from meat and a whole lot of other things, but the liver makes a variety of proteins with different functions. Okay, so when the liver is dysfunctional, protein becomes a problem. Also, in terms of the lipids, fat. Okay, the digestive enzymes for fat are coming from the liver. Okay, so that liver is paramount in correcting this type of problem. So that is why you find, for instance, it was distended. Okay, it was battling to do its function, and he also had a lot of stagnant bile, such that when I started giving him the medication that would get that bile to flow, the aunt that was working with him said his stools were very, very green. It's as though he had just taken spinach liquid. So they were very green and they were very slimy. Okay, now the sliminess was coming from the mucus that was coming from his lungs. Okay, because now we were clearing all that. So such that the aunt said at some stage she struggled to break the stretching of the slime, okay, of that mucus, because when she wipes his bums, the wipe would keep on stretching. Something would be coming and stretching. So he was releasing all that mucus. So I worked on that. But in the liver, I did not only reduce the size, because we had to get it back to its normal size. So we had to reduce that swelling, and we had to help it to move that stagnant bile, and we had also to repair the cells, okay, and beef up the enzymes, the digestive enzymes. So how was he ever going to grow up if he was having prenan at almost 6 months, but he was still drinking milk that is meant for such underdeveloped digestive systems? Okay, so I had to work on that, and then I had to work on containing the inflammation, because remember he was on cortisone. Now cortisone he was also on Bactrim, to try and contain the inflammation. But because I had worked on his respiratory system, because remember what causes a lot of inflammation is when you're not getting the good supply of oxygen, which was the case with him, because those sacs could not do proper gaseous exchange. So his treatment was a cocktail of product. It was a range of things that we were doing simultaneously. Okay.
Do your patients do Do they have to have conventional treatment even though you're treating them, or is it just a case of when they already are, then you just continue? I just want to understand that, can you solely treat a client without any other medication, just your treatment protocols?
That is what I do. But then you must remember that people come to me with their lots of what is prescribed by their doctors. Okay. But they come to me because they are on this medication. They've been taking it for so long and they're not getting a relief. But they're just hanging on to that in the absence of what else is there. Okay. So when they come to me, they say, I've got this. So I'm in a position to say, okay, because I'm providing this. And you must remember, their medication is based on symptoms. Mine is based on the cause and the symptoms. Okay. So when so which is giving me an advantage, because I'm not just focusing on that you've got respiratory problems. I'm focusing on the fact that, this is what is causing you to have respiratory problems. But you do have respiratory problems. So I'm going to deal with what is causing you to have respiratory problems, but I'm also going to deal with the respiratory problems as well. Okay. Whereas with them, they're focusing on you've got respiratory problems and they're going to keep focusing on that. Okay. So that's my advantage. This boy, remember, I treated him before he was a year old, and today I would like the viewers to see how he is.
Chatter, I am God and I never fail. Chatter, yesterday, today and forever the same. Chatter, remember.
I think this is where we're going to end for our viewers. Those parents that are sitting with problems, maybe the child has got serious cognitive problems, intellectual problems, or you just are hitting the wall because you don't know what else to do. You can try us. I'm not saying we will be able to fix or to help all of them, but I can promise you we can go a very, very long way to turning around the life of your child, just like we did with this one. Thank you for watching. We will see you next time. Goodbye.
Chatter, I am God and I never fail. Chatter, yesterday, today and forever the same. Chatter, remember.
Are you sitting with an illness with no diagnosis, and every doctor in town does not know what is wrong with you? Don't throw in a towel. There's hope for you. St. Mary's Alternative Clinic is a clinic with divine guidance that can do what doctors can't do. Make a booking and you won't be sorry.